is Wendy Weidner. I'm the Research and Policy Project Lead at Alzheimer's Disease International. Today, we're going to be talking about a subject that's really important to all of us on this panel, and it's about integrating innovations from low and middle income countries into AD initiatives. And this is a really important discussion for us too at ADI, for sure, because of our 102 members globally, many of them are from low and middle income countries, and we're always impressed with the innovations that we see coming through from our partners, particularly this year during the COVID-19 pandemic. We were amazed to see the innovations and creativity that came out of our partners and our members. They really galvanized around it and led, coming up with really creative solutions around how to support and advocate for people living with dementia and their carers. You might have heard discussions around this from my colleague Paola Barberino earlier today, who discussed this with other panelists. And I know that George himself mentioned that, for dementia, we really need to find a global solution. And this means we really do need to integrate the innovations that are coming out of low and middle income countries. And so I'm really pleased to be joined by my colleagues and friends on this panel to talk about this subject, because I think this is very near and dear to all of our hearts. We feel that innovation from low and middle income countries is really a two-way street, and we're hoping to bring different discussions and a different perspective to the conversation today. And so I'm going to introduce my panelists first. So we have with us today Ishtar Govia, who is the Senior Lecturer at the Caribbean Institute for Health Research. She's also the Senior Researcher and NGO Lead for the STRIDE project. ADI is a very proud partner in that project. We also have Adesola Ogunniyi, who is a consultant neurologist at the University of Ibadan. Martin Knapp, who is an economist and a PI of the STRIDE project in the London School of Economics. And last but not least, we have Tarun, who is the head of the Brain Health Unit at the Department of Mental Health and Substance Use at the World Health Organization. And she's also the WHO focal point for the implementation of the Global Action Plan on Dementia. So the way we're going to run our panel is we're going to have each person speak for about 4 to 5 minutes and take questions. So please put them up onto the platform, because we'll try to get to all the questions. Hopefully at the end, we'll have more time for questions, and then we'll each have our call to action. So without further ado, I thought I would start first with Ishtar, for you to give your perspective, please, on innovations coming from Jamaica, where you're speaking to us from. Thank you, Ishtar. The floor is yours.
Thanks, Wendy, and thank you all. This has been such an informative and invigorating meeting so far. So exciting. And my role today, I think, is to start us off with some provocative questions. So one of the key points that we've heard a few times throughout today is about the current and projected burden of Alzheimer's disease, that is disproportionately in low and middle income countries. We know that by 2030, of the over 73 million people who will be living with Alzheimer's disease or some other type of dementia, the vast majority of those persons will be living in low and middle income countries. So innovating should therefore start with low and middle income countries. So how can the innovations landscape begin with low and middle income countries? What does that mean practically? It means that we really need to ensure that the innovations are fundamentally centering the challenges and the opportunities in these spaces and places. So in innovating, we need to center the vast socioeconomic disparities in terms of care and access. We need to center the lack of universal health care in most of these places. We need to center the disproportionate focus of the health and social care services in the urban versus the rural areas in so many of these countries. We need to center the minuscule funding. It was really interesting to hear the panel before talk about some of the innovations around financing infrastructure. But we really need to center the minuscule funding that is available in low and middle income countries, and particularly for health ministries. Center the siloed approaches. We need to center the high levels of illiteracy, the high levels of stigma, the low prevalence of completing education. We need to center the prevalence of shared risk factors, because low and middle income countries also bear the disproportionate burden of other non-communicable diseases as well. And center things like the difficulty with medication access, medication affordability. So really think through what is feasible in these contexts, what is acceptable in these contexts, and what is affordable in these contexts. And as an example, I think the Lausanne meeting can and should flip the script when it comes to centering low and middle income countries. So throughout the dialogues about the diagnostics and detection, throughout the dialogues on therapeutics, it's really important that we're hearing about clinical trials, we're hearing about other types of applied work that is happening in low and middle income countries. So privileging these places, privileging these countries is important and should really be the default. So when we think about what needs to happen with infrastructure, we really need to think about how to facilitate partnerships that can strengthen and direct resources to ensure that the infrastructure is as strong as it possibly can be, to be as supportive as it possibly can be. Thank you, Wendy.
Thank you, Ishtar. I mean, I really, a lot of what you said chimes with me, talking about, I love how you put it, flipping the switch, and that need for really facilitating partnerships, and that focus on privileging LMICs and making them part of that conversation. So I have a question here for you. How would you like to see innovation transformed for Alzheimer's disease in low and middle income countries, and to benefit low and middle income countries?
This is part of my call for action, is really investing. People need to put their money where their mouth is. It's nice to see on these beautiful infographics, etc. We know the burden is disproportionately in low and middle income countries, but in these contexts, we have severe limitations in terms of infrastructures, in terms of bottlenecks, in terms of financing and capacity strengthening in a way that is not a parachute type of, we dive in, we run these clinical trials, we from the outside run these clinical trials, we from the outside have these lovely, beautifully integrated, presented systems of care and information access. We from the outside can use these data now to develop these personalized treatments and treatments programs, but we really need to do this in a way that is sustainable. So I think that's really what I would like to see. It's sustainable investment in not just academic institutions, but definitely to a large extent, it has to be the academic institutions in these countries. And it has to be done in a way where it's partnership building, so that opportunities can be taken advantage of when they come along. So with a visionary type of approach to thinking about funding, not just waiting for a funding opportunity that will come in a year, but we need to be thinking, as others have been saying throughout the day, in terms of 5 years. So what if we want this to happen in 5 years? How can we really spend the time and the money to develop capacity strengthening and mutual learning? Because there are so many things that are happening in our country context that others can really learn from.
And you have a really unique perspective, Ishtar, because you are both an academic researcher, but you're also quite involved with NGOs and civil society in Jamaica. And do you see that as an area where we can do a lot of that capacity building and a lot of that co-production around looking to the future in terms of innovation and sustainability?
Most definitely. I think it cannot be one without the other. I'm in a very privileged position myself to be with the STRIDE team, which Martin, I'm sure, is going to speak about, in both a researcher role and a role of a liaison and a lead for non-governmental organizations, because we need the dialogue to be coming from multiple perspectives. And in terms, in Jamaica, for example, that has fed, one has fed the other. If we as researchers that are based at one academic institution in one part of the country, we do not have feet on the ground in all parts of the country. So most of these non-governmental organizations, though, they do. Some of these charitable organizations, they do things like a Rotary Club, things like other places of worship. Even in Jamaica, we have the highest prevalence of churches per square mile. So we really have to think, for example, of these context-specific resources that researchers can be working hand in hand with their partners outside of academia or outside of big pharma to accomplish. How do we really get more people to be less intimidated of admitting something is wrong and first entering into a care pathway? How do we get more of the doctors, as other panelists have been saying, whether it's a psychiatrist or a GP, to be aware that dementia is not a normal part of aging? So all of these things are ways in partnering with the Kiwanis Foundation, in partnering with Rotary Club, for example, in partnering with associations for retired persons, we have been able to then leverage their voice and their platform to reach a broader network of persons who could then probably be enrolled, be invited to enroll in things like clinical trials, whether those exciting ones that were being talked about, the primary prevention trials, secondary prevention trials, even when we get to that point. So I think these are real rich opportunities for partnerships.
That's brilliant. Thank you, Ishtar. Really an example of how we have to take a multi-pronged approach to this. There's not just a silver bullet. It really is something that's quite complex, and we need to make sure it's appropriate in each context. Thank you. Then I'd like to move on to our next speaker. Adesola, you are next. We'd love to hear from you. Please, the floor is yours.
Thank you very much for having me on this platform. And I'd like to thank Ishtar for starting off our panel. She's done a great job highlighting all the problems with innovation in Africa and other low and middle income countries. And Africa is not different. We know that dementia is a growing problem. It's projected that there will be between 200 and 400% increase in number of cases in the next 30 years. So we're facing a daunting challenge. We've made progress in terms of diagnostic instruments for making clinical diagnosis. But we have challenges when it comes to doing finer things that have been presented at these earlier panels today. Things like retinal amyloid imaging, things like biomarkers in CSF and in plasma. There are very few studies on this from Africa, and this is a big challenge. We have neuroimaging, which is limited to MRI and CT scans. Things like PETs are not available in most places in Africa, but we have SPECT. So it would be nice if researchers can collaborate and see how they can bring researchers in middle and low-income countries into using facilities or techniques that can utilize SPECT for ensuring diagnosis. We need to ensure that we can predict risk. That's very important. Currently, we use cognitive cardiovascular risk scores following the FINGERS model. We think we should go further. We think there is some hope in doing that so that family members can know whether they are at risk of this disease. ApoE is something that is also catching on in Africa. We've now shown among the Yorubas that there is increased risk with those with the homozygous E4 allele. So if we can have facilities for making diagnosis of E4 allele or ApoE in general in the population, that will help in knowing individuals who are at risk early and planning preventive strategies to reduce the burden of dementia. Treatment is a challenge in low and middle income countries, and Ishtar has dealt at length with some of these. Drugs are not available, and even if they are, they're very expensive. We've experimented with cognitive stimulation therapy, which has been shown to help cognitive performance, reduce caregiver burden. But this is at the epidemiological level. We need to be involved in clinical trials. They cost money. So we need to develop policies that will ensure that looking at elderly people, we're able to help them as much as possible, as is done in high-income countries. Some of the things that have been discussed at this conference have been quite stimulating and fascinating. And it is possible that we should be able to do this if there's collaboration, again, as Ishtar has emphasized. So collaboration is important. We need to look at innovative ways of treating patients with Alzheimer's disease. We need to improve our diagnostic facilities and bring in innovation in these areas of research. We've done some work on cardiovascular biomarkers in relation to cholesterol and ApoE, and we showed some interaction. These are areas in which we can develop further, so that at least in a part of our preventive strategies, those who have elevated cholesterol in time can be screened for dementia, and we can do something to help them so that family members will know whether they're at risk or not. I think those are some of the things that are important with regards to Africa and with regards to other low and middle income countries. But I align completely with what Ishtar said. Thank you very much.
Thank you, Adesola. I mean, it's been, I agree with you today. The discussions have been extremely interesting. And I was interested to hear what you were saying about biomarkers and CSF and whether or not this is whether you're seeing it where you are in Nigeria. And I know you're speaking for sub-Saharan Africa. But one of the questions that has come in is saying, what kind of technological advances will be appropriate for patients with AD in sub-Saharan Africa? I mean, CSF, looking at that, PET scans, as you're saying, it's very expensive. Are these technologies that can be used, are being used?
No, PET technology is not being used. It's not available. We just use neuroimaging, MRI, CT scan, which is not enough, as if you want to go deeply into understanding the biology of some of these conditions. What we need in Africa in terms of innovation will be facilities that will help caregivers, since most of the care for patients with dementia is at home. So we need to bring the caregivers in and see how we can elevate some of the stresses they go through. Aimless wandering, for instance, is a problem. People live in their homes and they then get into accidents outside. If there are ways using technology in which you can know when people leave the house unexpectedly, using GPS, transformation of GPS technology to monitor mobility, I think that will help. If we can use cell phones, and now these things are very readily available with most people and most families. If you can have ways in which you can prompt them to remind them on things that they need to do, time to take your medicine, it's time to go to the bathroom, it's time to do this and that. I think that those are simple things that can help reduce stress on caregivers and make caring for individuals with dementia, Alzheimer's disease in particular, a lot less stressful in places in low and middle income countries. I think those are some of the things that I have in mind.
Yeah. Do you think these kind of innovations or these kind of technologies are available in urban and in rural settings? Is this something that can be widespread?
Initially, they'll start in urban areas, but with time, people are getting better informed now, and some resources are improving. If it's shown to be helpful in urban areas, certainly those in the rural areas will tap on. A few of them may benefit from it, but certainly it won't be as universal as in urban areas. And amongst those who are educated and who have the resources to purchase these things, but they will help, at least for the few that can benefit from it.
I was really interested in what you were saying about some of the genetic diversity that you were mentioning with, I think, Yoruba. How applicable is this sort of genetic diversity in Africa in sort of understanding the pathogenesis of AD?
Thank you very much, Wendy. We know that Africa has the largest genetic diversity because of, that's where the human race started. So we have various genes, and we don't know which ones may be incriminated in disease pathogenesis. So it would be nice if participants from Africa can be included in studies on genomic studies on Alzheimer's disease to see which peculiar things might stand out and help in picking out individuals who are at risk of developing disease. We've done some GWAS studies, and we're yet to get all the results outlined, but showing that there may be some new genes apart from ApoE that may increase the risk for Alzheimer's disease. And these are things that may be challenging and very interesting in years to come if we can replicate such studies in other countries in Africa. The problem is the money to be able to fund such studies. And we can't overemphasize that to bridge the technology divide, we need money. And our governments are not prepared to put money in this area of health. So we need a bit of advocacy to get this done. Okay.
Do you think this kind of thing would be helped with a national dementia plan, for example, where the focus would be on supporting that kind of research?
I think so. There is the International College Panel on Alzheimer's disease that suggested that some of these things should take place. And these are things that should be taken and translated into policy to bring about changes that will then make life easier for researchers on Alzheimer's disease and for caregivers and individuals who have Alzheimer's disease. Thank you.
One final question for you about the clinical trials. One of the things that has been sort of mentioned to me in various discussions about clinical trials in low and middle income countries is the idea that health systems need to be strengthened. Do you think that this is the issue around clinical trials and trying to encourage pharma to bring clinical trials to low and middle income countries?
I think the problem with many countries in Africa is that dementia is not regarded as a priority at the moment, mainly because the population is considered relatively young, and a lot of the government officials are not familiar with this. So health system change might bring some difference in the academic circles, but in reality, we're not going to see much. So it won't translate to better health for individuals with dementia. So we need a lot of advocacy, and we need NGOs and all these other international bodies like this forum. Findings from this forum can be disseminated widely and governments informed about it. I think that will go a long way in making the kind of difference that we want. Thank you.
Thank you, Adesola. And you created a perfect segue to our next speaker, which is Martin Knapp, who is from London School of Economics. And Martin, the floor is yours.
Thank you very much. Yes, it was the perfect segue because, as Adesola said, for example, in sub-Saharan Africa, the populations are relatively young, but those populations are aging very, very rapidly. And the challenge, if you like, of dementia, of Alzheimer's disease, is enormous in low and middle income countries. So I'm a researcher. I'm going to talk about research, particularly a project that Ishtar mentioned already, the STRIDE project, which is looking to strengthen responses to dementia in low and middle income countries. And we're working actually in 7 countries: Brazil, India, Indonesia, Jamaica, Kenya, Mexico, and South Africa. They're all middle income countries. And it's that sort of stratum of countries in the world which have the most rapid aging populations at the moment. Low income countries, it will follow a little bit later. So I'm just going to describe quickly what we're doing in this project. I think it's a very exciting project, but I'm hopelessly biased because I'm the PI. But I think it is a project that is trying to do a number of things. It's not North telling South what to do. It's quite the opposite. It is a proper engagement, a parallel horizontal engagement of people across those 7 countries. It's led from LSE, but there's lots of involvement from ADI. Wendy's very much involved in the project. Dementia Alliance International is heavily involved, as well as a number of NGOs across the countries, and I'll say more about that later on. So what are we trying to do? One of the things we're trying to do is to build capacity in doing research, in using research and absorbing research. And that's not just training researchers, that's about building skills in NGOs, in, as I say, particularly in using research. So one of the very first things we do in the project in each of the 7 countries is have a theory of change workshop. And that's where we bring together people, including people living with dementia, carers, family members, people delivering services, government officials, advocacy bodies, researchers, and so on, in these workshops to try to understand what is the challenge in that local country context of dementia now and over the coming decades, and what will be a good way to address that challenge. What do we need to know? And the sorts of things that Adesola was talking about, exactly that's kind of comes into that dialogue. So what we're trying to do is build capacity in, say, generating and using research. We want to then use that research, use that evidence from research to support policy discussion and practice development in those countries, and particularly to understand the impact of dementia in different cultural, social, and economic contexts. And when I listed those 7 countries at the beginning, there's incredible diversity across those countries and incredible diversity within those countries, as we were just hearing as well. So we're trying to understand how those different contexts have a bearing on and how we interpret the challenge and respond to them. And then developing evidence in ways which I'll talk about in a minute. So it's a participative project. I mentioned the Theory of Change workshop. We're doing what is the most inadvisable review ever of literature. We are covering all the interventions that work or don't work in dementia across all lower middle income countries, using evidence published in all languages. And I had a meeting yesterday. We're talking about how to manage all of the many trials that have been published in Mandarin and Cantonese to then absorb that evidence. So we have that review is underway, nearly finished, and that will then tell us what we know about what works in a range of different country contexts. We then have some particular packages we do in some countries. We're looking in a couple of countries to get a better handle on prevalence and the patterns of need among people living with dementia. In other countries, Jamaica is one of them, we have a much more detailed look at family and other unpaid care and who those carers are, what they do, what the challenges are that they face. And then in other countries, we're looking very deeply at awareness of dementia and the stigma associated with dementia. And we know, I'm sure we all know, in a range of countries, that stigma is really quite acute. And then another bit of the research is then marshalling evidence on what works and the economic case. I'm an economist, as you probably can guess from the way I talk, but trying to marshal the economic case for how to improve the lives of people with dementia and their family members. So that's the project we started in 2018. We're due to finish December next year, but we're going to have to go into 2022 because of the COVID delays. But it's going very well, and it's actually a very fun project. So just finish with sort of key elements which I think are important for research of this kind, and these build on what we've heard already. So one is that it is about capacity building. It's not about parachuting in. This is a trial which works, shows things work in Southeast England. It's going to work well in Southeast Nigeria or South Africa or Jamaica or whatever else. No, it's not the case. We need this. Evidence needs to be built up locally, and the capacity needs to be there to do the research. So that's one. Second, we have a very strong ethos of shared decision making. This is not north-south. This is a much more participative model. We have strong involvement of people living with dementia, but actually that's more challenging in some countries than others, because in some countries the stigma of dementia makes it harder to encourage people to get engaged in research, and that's a challenge which we don't experience in anything like the same way in the UK, for example. And it's a genuine full team effort. And we have now teams in Kenya, for example, leading research proposals, in Jamaica and so on. So I'm delighted that I'm involved in STRIDE. I'm delighted that Ishtar and Wendy are involved, and happy to take any questions.
Thanks, Martin. Well, I'm biased, I think, because I can attest to the fact that it's been fantastic to be involved with the STRIDE project. Very much, as you say, a very collaborative effort, and I loved how you put it, horizontal engagement across the project. I wonder, there'll be a lot of people that are watching this who are also researchers who might be interested in running. It's quite a complex project across 7 countries with all of the, and also unique in that it has the NGO involvement and the research involvement. What would you say is the secret of success? What would your words of wisdom be to researchers that are thinking about and engaging in this? And how have you incorporated some of this into the work that you've been doing and created such a great ethos for all of us that are involved in the project? Because it really is feeling horizontal.
I could be silly and I could be sensible. I could be silly, first of all, to say stamina and hanging in there and so on are important. But I think what was very important, these theory of change workshops, I've not done theory of change before in projects. It's the first time for me, and it was an eye-opener. These were the first time in many of the countries, these were the first times that the officials that had responsibility for dementia policy had met people living with dementia. So these are really important events to bring people together, try to understand different perspectives, and then build a platform. And from that platform, you can then see, we need evidence on this, or when we get evidence on that, this is going to help us to interpret it in this particular context. So I think that sort of participative model is really important. It makes research more complicated. It's much easier for research if you stick in your ivory tower and say, we'll do this, this, and this, and then we'll write the results and publish in a journal. Doing real research, which is going to have a real potential impact, is much messier, much more untidy, but much, much more satisfying. So I think it is about participative models.
And already spilling over into other areas, isn't it? I mean, there are other countries that are trying to pick up on this sort of theory of change and do STRIDE-like projects.
Yeah.
Is that right?
Yeah, so we're trying to encourage there are other countries and territories across the world that are doing that. There's one of the low-income countries of the world, Switzerland, is part of this project now. But they're copying. That's a joke, by the way. They're copying some of the elements of STRIDE. New Zealand are in, Hong Kong are in. We're talking to some other countries across the world that are doing different elements. So I think we are keen that it's not a. We're very happy to share the modules we've got and the tools we use, and people can then do some of those. We're just trying to build up this evidence base and this participation in generating evidence as widely as we can.
Okay, and I've been told that I'm going to have to move on. I could talk about STRIDE forever with you, Martin, but we're going to move on now to thank you very much. And we'll move on now to Tarun Dua, who's going to tell us a little bit more about what's going on at the World Health Organization. Tarun, the floor is over to you, please.
Thanks, Wendy. So it's always a good and bad thing to come at the end of the panel and also at the end of the day. So you would have been all tired listening on the burden due to dementia and the costs that have been emphasized. Has been emphasized from the beginning. And I think I appreciate very much that even in the introduction, when Josh talked about it, he mentioned the high burden in low and middle income countries. So really, it is very important that this conference and this meeting is prioritizing the discussion of dementia in low and middle income countries. And when we look at the challenge in low and middle income countries, we understand that there is lesser prioritization, lesser resources, and lesser action. And I think it's all about how do we move forward in having that global action, and which is also the mandate of the Dementia Action Plan, which was endorsed in 2017, asking countries to have a multi-sectoral response to address the dementia challenge. We looked at 3 years on, where are we with its implementation, and all the areas we are very much behind on achieving the targets. And And I think one message that I would like to convey today is that we can't achieve any of those targets unless we step on the gas. I think that's ultimately very crucial. COVID-19, Martin talked about the delay, in the various activities, and this has impacted all of us. We had a specific session on the disproportionate impact of COVID-19 in older people and in people with dementia. But the comment that I have is that understanding the COVID-19 and in the interaction and the impact on people with dementia, how does this become an opportunity for us for more advocacy, more action, more services? How do we use that to lobby and for prioritization in the countries where it is not happening? We heard about the actions, by the different member states, civil society, private sector. All of this has been happening, and I'm not downplaying any of the responses that have been undertaken so far. For example, like in the morning session when Franca, she was talking about the response that Canada has been taking around this, and many of these actions are very much in line with our global targets. The awareness campaign and the advocacy that Alzheimer's Disease International has been taking. But we have also been looking at some of the gaps and picking up on the point that Adesola was making about the dementia research, especially in low and middle income countries. I think I wanted to take it forward and just mention a little bit about the dementia research blueprint that we would be starting and supported, which is supported by Gates Ventures, is that and the objective is has to have within this prioritization that we have coverage of all the critical areas, looking at the full care pathways. So from prevention to treatment, cure, and implementation science. And you have heard lots of those examples. And it is about how do we bring all of them together. But the second objective, which is very important for us, that how do we make these research efforts rooted in equity, diversity, and inclusiveness, and at the same time, building up research capacity across all settings and including people with dementia and their carers. So, and how do we learn from different countries across the world? For example, when we are looking at research output, we see the countries in European region are doing very well, and some of them are not like the United Kingdom or other high-income countries, but there are many other countries who are doing much better. So what can we learn? How can we share these learnings? So that's I think that's one of the things that we need to bring this up through the research blueprint and work closely with researchers. The second part of the research blueprint, and that which links up to the title of this session, is thinking when we think about innovation. For me, and this is taking up from Grand Challenges Canada, that it is not only the science and technological innovation that are important. It's the social innovation, the business innovation. Those are also extremely important. And I think these have they go a long way, and these have an important role to play when we think about dementia. So, for example, like awareness raising, it has been raised by Ishtar, by Adesola. How can we have social and business innovations for awareness raising? We can all think of technological solutions, but how do we think of these? And Grand Challenges Canada talks about an integrated innovation. The last point that I wanted to emphasize, and which is also something very close to our heart, is data and the work that we do through Global Dementia Observatory. I think what we see is that no data means countries think that there's no problem, no action. So that's also an important thing. We have Global Dementia Observatory. Now, if we look at the data that we have currently, 60 countries who have given us data, 80% of them are high income countries. It's the low and middle income countries who are not giving us the data. And it's not that they don't have data. Some of these are very important. It's just that there is, it is also when countries, member states, they give data, they realize, we have a problem, and that means that we have to take some action. So this is also very important that we look at this data, and data plays an important role in terms of innovating at country level. And I can go on and on, Wendy, on why this issue is so important and so close to our heart, but I'm conscious of the time, and I'm going to stop here.
Thank you, Tarun. I completely agree that, and this really stems out of a lot of the work that we're doing on the STRIDE project, that data and evidence is so important, and the work that's being done in the GDO is key, because it provides some of that data and evidence that can be used then to raise awareness, use for advocacy, et cetera. Now, you're saying it was quite interesting, 80% of the GDO data is coming from high-income countries. What can we do to encourage and facilitate low and middle-income countries in getting some of that data? Is it about letting them know how they do it? Is it about getting them in touch with their focal point? What do you suggest?
So thanks very much. I think one of the important role where if we really have to see action is the action that can happen bottom up. And Wendy, so this will be actually a call to the civil society partners, to ADI partners, to say that can you convince the ministries to submit the GDO data? So because this data is important for us as people with dementia and our families to make things happen. So that's ADI in 80 countries. So there is absolutely there, and you are more in low and middle income countries. So that's a civil society partnership that I can already think about, right? We have then other initiatives, and I think what I'm trying to say is that for data, for evidence, but for action, we are looking for catalysts. So then this is the call for George and others who are very much working on this Davos Alzheimer's collaborative, that how do we involve countries? And this is where I would encourage that we don't go to the same country with all our efforts. So if STRIDE is in 7 countries, let's identify, a set of other countries for different initiatives. And there are, so that would be another way of working. There are other partnerships like the Worldwide Fingers. How can we leverage that? 1066 Dementia Research Group. How can we leverage on that? There are NCD Alliance. So there are various bottom-up approaches that are required to convince the ministries to take action. I think this is, and we have seen this for other fields. We have seen this in HIV. And I think it's high time that together and not fragmented, but in a coordinated voice, we ask our country ministries to say, okay, prioritize dementia because you should be doing much more than you are currently doing.
Do you think this is something, I completely agree with this, do you think this is something that will come out of your blueprint, your research blueprint that you were discussing? Because I know that you were saying is that you really want to involve low and middle income countries in a partnership in this. Is this the kind of thing that you see coming out of that?
Wendy, definitely. So we will be coming out with a global status report on dementia. And I think some of the messages that I'm starting is a kind of a teaser to some of the things that we would be saying in that global status report, and we'll release some more teasers in your conference next week. So watch out the space. But just to say that, yes, all countries signed up to the action plan of 2025. We are very, very much behind those targets, and we need to have these research blueprint. We would like to see that what Adesola is talking about, clinical trials and involvement of researchers and having those efforts brought together in Nigeria, they happen. So I think let's make these individual targets, and let's see, Adesola, we can answer. Let's see if we can have Stride plus Martin and 7 more countries get in 2021. Let's do that. And December 2021, we see what have we done in Nigeria, and do we have 7 more countries? And these are low-income countries like Switzerland and Hong Kong, but let's get some of the other low-income countries and see where we are. So I'm putting ourselves to challenging ourselves here, Wendy.
Okay, good. I wondered if I could bring in all of the panelists now, because we've got just about 5 minutes left, and I know that what the key thing that I really want to do, and I know that you want to do, we're all quite keen to walk away from this with some action points. I think that's the important thing, and it's great that we're here at Lausanne in this format that we're able to talk about some of these things. But it would be great to push this forward to next year as well. And I'd like to go to each of you in the last 5 minutes just to have a roundup of what you think the call to action would be in the next year. Ishtar, I'd really like to start with you before we close, please.
Thanks, Wendy, and thanks to all the panelists. Such a stimulating exchange. My call to action is to invest in low and middle income countries, invest in institutions there, in teams there, for the development of scalable and context-appropriate innovations that are really rooted in places where there are the populations that need this the most. And investment, again, is not one-off, because even in Jamaica, for example, we're ecstatic that we're part of Stride, but being part of Stride means that our eyes and institutions are open to how much more we need. So while I'm happy to think in terms of expanding more countries' involvement, I think we also need to be cautious that people can just feel a sense of satisfaction. Funders can feel a sense of satisfaction by checking a box. We've given some money to Jamaica. We've given some money to Nigeria, etc. Investment is long-term for sustainable change.
Thank you. That's excellent. Long-term investment. Adesola, please, could you give us your...
Thank you very much. I've really enjoyed the session and the presentation by all the panelists. I think my call to action will be in the area of collaboration in research. This goes along with what Tarun had talked about and everybody else. We need to get low and middle income countries involved in research, and it could take various forms. And secondly, I think we need to have, in terms of business innovation, we need to think of low-tech research that will benefit individuals with dementia in low and middle income countries. They should be cheap, affordable, and utilizing available technology in those countries. But by and large, the most important thing is to pay attention to prevention, because that's where the key is. Since we can't match the high-income countries in terms of innovative technology, but if you can prevent cases from developing dementia, I think that will go a long way. And we have the Lancet Commission report to go by, so that we can identify those behavioral and medical conditions that can be acted upon to reduce the burden of dementia. Thank you very much.
Thank you, Adesola. And I'm going to move over to Martin.
Thank you. It's been a really good session. Thank you. I've got 2 calls for action. So one on the research side. So I've just written down here, build capacity to generate, understand, absorb, use, and challenge research evidence. And I think all of those verbs are important. So that's the first one. And the second one, I think, is we haven't really talked about it very much, although Adesola did pick up a little bit earlier, is to understand and address inequalities. And I think inequalities of experience and access and everything else. So, and thank you very much for involving me.
Last but not least, Tarun.
Yeah, so I think from WHO, we would like to, let me go with some call for action with C's. We would like to be the catalyst for action. So we would like to work closely with all of you in being being such a catalyst. And we would like to enhance collaboration and reduce fragmentation as we move forward. So count on us. We are here to work with all of you. And we would like you to work together with us as we keep in mind that it is people with dementia and their families that are at the center of all the work that we do here. So thanks very much to the organizers for having this particular session. And thanks to you, Wendy.
So before I hand over to George, here you have it. We want long-term investments, collaboration and research. We want to build capacity. That means understanding and using and challenging research evidence, addressing and understanding inequalities. And we want to work together. And WHO is going to be walking alongside us. These are all topics we're going to talk about at our ADI conference next week. Please join us. Thank you to all of my panelists. You guys have been amazing. Thank you to everybody who's logged in and sent questions.